Welcome to my new medical channel. We will begin our journey by talking about a person who suffered a stroke and subsequently lost his ability to speak, but he recovered. How did this happen and why might someone suffer a stroke given the increased risk of developing it? Marco is a person who suffered an ischemic stroke. After receiving first aid and taking the necessary measures, he survived, but he lost his ability to speak due to damage to Broca's area in the left frontal lobe of his brain. However, after continued medication and rapid psychological and physical therapy, he gradually regained his ability to pronounce words. Years later, he was able to speak almost like a normal person. This is amazing, isn't it? This is what is called neuroplasticity, the ability of neighboring neurons to take on the functions of damaged neurons, forming new synapses and strengthening them with practice. But why does Marco's story inspire us to succeed? This is because it is an extremely difficult process that requires patience, strength, and determination from both doctors and patients. Neuroplasticity requires choosing the optimal timing, not delaying, and using the necessary medications that stimulate signals and neurotransmitters, especially dopamine, and increase the patient's alertness. This is to avoid the risk of delirium and dementia after the patient's immediate recovery. This also prevents infection, which is the most dangerous cause of death after a stroke due to a weakened immune system resulting from increased cortisol and catecholamine levels after a stroke. Other factors require further study. Furthermore, the affected brain area is related to the activation of neuroplasticity. For example, the primary motor area may be replaced by some neurons from the secondary motor area due to the presence of related neural pathways. The factors that cause stroke are numerous and depend on the type of stroke. If the ischemic cerebral hemorrhage is caused by infection and inflammation, then infection and inflammation are risk factors that cannot be ignored, by activating cytokines in response to an antigenic stimulus, which causes atherosclerosis, which occurs most often in chronic infections. Also, disturbances in heart rhythms, platelet activation, and coagulation help increase inflammation and infection, especially viral ones, which have recently increased the risk of infection after the coronavirus, COVID-19, and systemic ones. Especially the urinary and respiratory tracts, which gives us awareness in early treatment of any inflammation or infection. Many health systems in America have followed the influenza vaccination to prevent atherosclerosis and coronary vascular diseases. While hemorrhagic stroke is less common, it may be caused by many factors, the most important of which are high blood pressure, age, aneurysm, diabetes, alcohol, drugs and age over 55, lack of movement and high cholesterol. Finally, we must prevent stroke due to the increased risk of developing it. You can deduce prevention methods from the reasons mentioned above. Thanks for watching.